2.3 million people in the UK have been diagnosed with diabetes, and that figure is growing by 100,000 every year. Good care for these patients is essential. Here in the NHS North of Tyne area, one of 3 Year of Care pilot schemes is underway, aiming to put diabetes patients at the very heart of their treatment.
The project itself aims to look at the concept of care planning and introduce that into primary care teams and how they deliver diabetes care. The other big element of the project is around how we commission services to support the Year of Care model. And in theory, the two comes together to provide us with an alternative framework for the delivery of diabetes care.
Year of Care is really a term that's used to describe all of the care a patient should expect to receive that's fully commissioned over the course of an annual cycle. So it's from year to year, based on the things that that patient and their health professional jointly decide are the right outcomes for them in the course of that year.
In practice, this has meant a change in the way of working. Diabetes patients like Philip Martin continue to receive routine checkups as before, but what happens next is different. Once Philip receives his test results, he'll have about a week to digest them and think through what are his most important concerns ahead of his next consultation. Malcolm Reed has done exactly this and is armed with questions when he sees his specialist nurse, Susan Robinson. Together they discuss his thoughts, and by the end of the appointment they jointly decide on a care plan for the coming year. These patients have been invited to discuss the new way of working and are welcoming the changes.
I feel I can sit and talk to whoever it is about what I've got to say, and I'm happy with that.
She'll go through the results. Anything on the results need explaining, she will explain.
I think they're more up for discussion, now. And I feel quite a lot happier about it.
We can see them 2 or 3 times a year, but we're not with them from day to day. So it is really important for their long-term health that they can manage it themselves. But it's also very important that they have education to be able to know how to manage their diabetes.
Knowing each individual's care goals helps to ensure the right range of services are commissioned to cover the needs of the population. This forms the foundations of good care. As we've seen, the patients themselves are encouraged to be engaged and informed in their care plan as they work with healthcare professionals. Then, together, the patient and their doctor or nurse can decide on the best action to manage the patient's diabetes. Overseeing all of this is the organisational processes of the service, the local practice and the NHS, ensuring the patient is happy with their care and has good access to services. Evidence suggests that when patients are more involved in the choices around their care, they are more likely to stick to them. Through the Year of Care pilot, appropriate services can be commissioned for diabetes patients by listening to their needs. And overall, the patient will always be at the very centre of their care.